Now we are going to move on down and we're going to go to the upper extremity. So moving on to the shoulder, elbows, and wrists. I'm actually going to have the patient take off the gown so that way we can see the range of motion better of the upper extremities and as we move to the lower extremities. So first for the shoulders, I'm going to have you take your arms forward like a zombie, forward flexion. Very good. Going in backward extension, take your arms behind you. Wonderful. The shoulders can also do abduction and adduction. So if you think about if someone gets abducted, they get taken away. And then adduction, ADD, adding together. So I want you to take your arms as if you're doing a jumping jack or a snow angel. So take up and then add them back together. Very good. So that is AB, abduction is away, adduction is coming together. So you add them together. Next, we're going to do external and internal rotation of the shoulders. So I want you to do external rotation first, taking your hands behind your head without interlocking the fingers. That is external rotation. Now internal rotation, take them behind your back. How I remember the difference is I think if you were going in the slammer or getting arrested, then you would need to put your hands in internal rotation for handcuffs to be put on. So think internal rotation in the slammer. And then finally for the shoulders, we have circumduction. So circumduction is like throwing a softball or doing what you'd have to do for jump rope. Very good. So for the shoulder, the patient had full range of motion, active range of motion. So we'll add that strength against resistance.
Hey, did you see the new study guide that follows along with this video? So cut your study time in half and increase your retention of the need-to-know key points and memory tricks that love to come up on nursing school exams. Plus, get 900 more videos not here on YouTube, neatly organized into playlists. Try it for free. Visit simplenursing.com today.
So to test that abduction and adduction, I'm going to have you just hold your arms into a T. Because remember, the important thing is opposing muscle forces. So keeping your arms here, don't let me push you down. Very good. Now don't let me push you up. Very good. So that would be full strength against resistance. So let's talk about if the patient didn't have full strength against resistance. A 4 out of 5, or sometimes charted just 4+, would mean that they have some strength against resistance. So let's say I could not do full pressure on the client's arms. Let's say if I did full pressure, they collapsed. So now I'm going to do it again, but I'm going to go a little bit easy on them. So take your arms up, and I'm just going to use 2 fingers this time to go a little lighter. Okay, still able to hold it. So that would get a 4 out of 5 or a 4+. Next would be a 3 out of 5 or a 3+. So this would mean that the client cannot handle any resistance, but they can hold up against gravity. So go ahead and place your arms out in a T again. Holding your arms up like this against gravity is no easy feat. If you've ever tried to hold your arms like this for an extended period of time, it gets more and more difficult. If the client can do this, but the moment I add any resistance, they collapse. So let's say if I add resistance and he drops, then he could still do his arms out, which means he would get a 3 out of 5 or 3+. If the client could not hold up against gravity, if I had to remove gravity, meaning I had to help the client through by removing that extra exertion that gravity pushes down, that would be that passive range of motion. So passive means I'm helping the patient, and that would be a 2+. 1+ would be if I have to do passive range of motion, but then also you only really get slight contraction of the muscles on their own. That would get a score of 1+. 0 or 0 out of 5 would mean that there is absent muscle contraction, essentially that the patient's having paralysis and that they have those flaccid or immovable muscles. Next, we will continue, now that we've gone through what that grading looks like, we'll continue with the rest of our strengths against resistance of the shoulders. So if you can, we already did abduction, adduction. So take your arm out in a zombie and just hold it there. Don't let me push you down. Don't let me push you up. So that tests our forward flexion and backward extension using those opposing muscle forces. Now take your hands back behind your head again. Don't let me pull you apart. And now go behind your back, internal rotation, like you're in the slammer. Don't let me push you apart. Very good. So that would be a 5 out of 5, or full range of motion and full strength against resistance. We don't routinely check the range of motion with the addition of the strength against resistance for circumduction of the shoulder, just because of the risk of tearing the rotator cuff. The rotator cuff is a series of muscles surrounding that shoulder girdle and can be easily torn in bodybuilders or anyone who really lifts weights, also easily torn in nurses, especially if you're not using great body mechanics while lifting patients in bed. So next, now that we've completed the shoulder, we're going to move on to the elbow. So I want you to extend your arms out like this. So that is extension of the elbow. Now flexing in, that is flexion of the elbow. For the most part, flexion is towards the body and extension is away from the body. So now go back into extension. I want you to hold your hands out like you're holding a cup of soup. This is supination of the elbow. Now pour that cup of soup out, and that is pronation of the elbow. So supination and pronation. You may be familiar with those terms of someone laying supine or prone. So supine would be as if you were laying up on your back, and that cup of soup might be in your belly or in your belly button. Prone would be if you pour that cup of soup out and you're laying belly button down. So next we're going to do the strength of the biceps, and of that elbow joint. And so typically we primarily check that flexion and extension. So I'm going to have you turn to the side. Wonderful. And go ahead and extend your arms out. Very good. Now flexing, bending at the elbow, pull towards in, pull, 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 pull harder, pull. I know you can do more. Very good. Now hold there and now push out. Extend your arms. Very good. All right. So we have full range of motion and full strength against resistance of the elbow. Now let's move on to the wrist. So your wrist can do flexion extension. So can you wave bye-bye like a toddler? You know, they flap their arms. Very good. And then your wrist can also do radial deviation and ulnar deviation. So can you shake it off like Taylor Swift? Very good. So that's full range of motion of the wrist. We're going to add strength against resistance. And we're primarily just going to check that flexion and extension. So using your hand like a gas pedal, go ahead and push down, push, 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 push. Very good. Now we're going to switch, pulling up at the wrist, pull back. Very good. Now we're going to do the hands. So I want you to spread your hands out wide. Very good. That is abduction. Now take it in, adduction. Now I want you to bend just at the fingers. Perfect. That is going to be flexion. And pull your fingers back, curving as if you had a manicure and you're looking at your manicure. Wonderful. So that's flexion extension. So you can also do circumduction of the fingers. I want you to go woohoo, as if you're going to a party. Very good. That is circumduction of the fingers. Then there is one thing that your thumb can do that your other finger joints cannot do, and that's called opposition. So I want you to take your thumb and go back and forth to the other fingers. Back and forth, faster, faster, faster. This also tests our rapid alternating movements, which is a function of the cerebellum. So wonderful. Now I'm going to test strength of the hands. So just go ahead and squeeze my fingers. Very good. So the patient had full range of motion and full strength of the hands and fingers, 5 out of 5.